Is China just exercising their control over people because they can? Is the coronavirus what we're told it is? And do you know how to even avoid it? Why is the government putting our military bases up for possible containment centers, kind of a camp for those that are infected, and legally, can they do that? We go into the coronavirus, what we know and what we don't know, in 1 minute.
This is the Glenn Beck Program.
When it comes to running your business, the scale pretty much doesn't matter. You could be doing $100,000, $1 million, $10 million, hundreds of million in revenue. And it doesn't matter if you don't have a way of getting a full picture of that business. It's easy when you have a smaller business because you can see everything. You're right there. Finance, inventory, HR, customers, all of these things, individual aspects of a company that you're running, and you desperately need visibility and control to make the right decisions so you can help your business grow. This is where NetSuite by Oracle comes in. NetSuite is going to make sure that all your departments communicate with each other, and it'll give you a dashboard that you can control from your phone or computer. It's the last system you're ever going to need. NetSuite is the world's #1 cloud-based business system, and it is trusted by more than 19,000 companies. NetSuite, their customers grow faster than the S&P 500. That could be you and your company. Schedule your free product tour right now and receive your free guide, 7 key strategies to grow your profits at netsuite.com/Beck. Set up your free demo. Get the free guidebook today, netsuite.com/Beck. So there's some satellite images that are right on the outskirts of Wuhan that show there's been a massive release of sulfur dioxide gas. And there is no place in the world right now that has this level of sulfur dioxide. Now, this could be one of many things. No other city is coming close to this. Now, it could be that they're burning municipal trash and possibly animal carcasses. And they don't do it at the dump where they're normally doing it. This is on the outskirts of town in an open field. There is another explanation, and this is the one that's sexy, I guess, and causes a lot of fear in people. But dead bodies are being burned on the outskirts of the city. And if that is what it is, the problem with this number is this comes from burning organic material. And to get this kind of sulfur dioxide into the air, apparently you would have to burn as many as 14,000 bodies. So if it's not that, what are you burning? There are also these hospitals that are springing up, and they're just places to take the people who are infected. I don't want to get into all the details on this because that seems even more sketchy than the sulfur dioxide. At least we have a map of these, and we can see the actual emissions and know what it is. But there are really nasty things that are possibly going on. Now, let me show you a video that comes from, and I'll describe it. It doesn't have any audio, and I will describe it. This is a woman that is running from the police. She's in a car chase, and she finally is pulled over, and the police drag her out of the car wearing masks, and she is being held down on the ground, and somebody comes up. He has a syringe in his hand. He's dressed differently than the police. Don't know if he's with the police or what, but He comes with a syringe. He injects her with something, and she goes limp. She doesn't appear to be dead, but she's no longer fighting anymore. She was then whisked off into an ambulance or a van and taken away, they say, because of the coronavirus. We have seen several of these videos now. What I don't understand is if this has only killed 900 people, that's a lot. But here in America, we have, in the same period of time, we have already lost 22,000 people just to the regular flu. So in a place like China, 900 people killed by this is not a big deal. Now, we don't know everything about it, but let me give you this stat. They're telling us now that this will be very different than it is in China because it attacks the respiratory system and those who are weak. In China, over 60% of the people there smoke. So and they've been smoking since they were like 14. So if you're smoking and you get into your 50s or 60s, your lungs are really, really damaged. You're hit with the coronavirus, and it's likely that you don't survive just because of the damage that has happened to your lungs because you're a smoker. The other that they have found is that it is attacking those with diabetes. So if you are a smoker with diabetes, you have a good chance of getting this and dying from it in China. We don't know what their services are like in China and how they're dealing with it. We haven't lost a single patient of this here in America. You will hear that we've lost an American citizen, but they were over in China. So we have cases here. We haven't lost any. And if you're not a smoker with diabetes, you have a pretty good chance of getting this and, going on with your life. Which brings me, if those are the facts, what the hell is going on in China? Why are they quarantining millions of people?
I mean, they can.
Yeah, and that may be it.
Right?
That's
like
what I started this with.
Yeah, maybe it's just that, they do see it as a legitimate threat. It obviously is. And they are an authoritarian regime that can do whatever the hell they want to their people. So they're taking action. Could be that. Or it could be a lot worse than they're disclosing. That's a legitimate worry at this point.
So
when it comes
today
to
is the day the factories are supposed to open up again. They've been on the Chinese New Year, and then the government extended it. They're having a problem getting people in to work. That was what they were expecting today. We don't know the results, but we were expecting, the Chinese were, to have a problem getting the factories actually open and running today. China, if there is one thing, they care about the continuation of China much more than they do their people. If they're closing factories or they were holding back any kind of factory work, that's going to hurt them. A lot of people don't have any kind of backlog past maybe March or April. In March, if the factories aren't going in March, that will affect everything into the fall. That is a massive impact, one that China cannot afford to make. So yes, we want to say, hey, they're doing this because they can, and they're doing this because, they care about the whole world, which I don't believe for a second. But maybe they're doing that. But why would they do it and hurt their own economy as well? Any thoughts on that one?
I mean, if they didn't believe it was going to be really bad, I don't think they would be doing these things, right? They think it's potentially really bad. And of course, when it comes to China having these issues, it will be a drain on everybody's economy. I mean, people won't be able to get parts from there. It's like a 100% tariff for a time, right? Like it's going to react that badly. So it's one of those things where I think it really can affect the entire world when it comes to the economy.
Imagine walking into an Apple store and they just don't have a part.
Yeah.
They don't have the iPhone. They don't have the iPad because they haven't gotten a shipment from them.
We were talking to somebody today who was their factory in China and their business, and they only have a stockpile till April.
Yeah.
And so, like, if this goes on till April, they just can't sell anything at all.
But that's all.
But that's it. Other than that, their business is fine. They just can't sell any more units. Kind of a major issue, and rerouting supply chains and all that is not really an easy option. I mean, it's hard to do, which is one of the big issues with the tariffs, and that, like, when you change suppliers to a new supplier, if you're in China and now you're going to take stuff from India or Vietnam or wherever it is, are you going to go back to your old United States supplier when the tariffs go away? That's one of the big complaints companies here have. They're like, well, they're not going to do that anymore. They're not going to come back to us. We gave it to them. And they could rely on it. Now they can rely on someone else. So why are they going to bother switching it up again to go to a higher priced country? That's the long-term worry about that. I mean, I think the economy overall is strong enough to withstand what's happened so far, as far as that goes. But when it comes to an entire shutdown of Chinese factories, that is something that we're not very well prepared to deal with.
No, not at all. And we get most of our medicine now from China. Mm-hmm. I mean, people aren't thinking about that. We because of regulation and everything else, we're driving the pharmaceutical companies out of the United States. And so they're not making them here. They're making them in China.
You see the thing that was going around where someone wanted to get a mask because they were concerned about the flu and the coronavirus, and they were going to put it on, and it said
made in China.
It said made in Wuhan, China, and then it said it'd been personally tested. Like, it was like normally that's like, it's like handmade is usually is something you like. It's got a personal touch to it. I don't want someone personally testing my medical mask in Wuhan.
Yeah, they died.
Yeah, they're totally toast.
The medical mask worked, so that's great. So there's also something that, again, is most likely just our government being efficient and preparing for the absolute worst, which I want them to do. 11 military bases near major airports in the United States are now setting up to be quarantine centers for possible coronavirus patients. Department of Health and Human Services asked the Pentagon for quarantine space in case the beds fill up at other coronavirus centers around the country. The Pentagon has already agreed to house 1,000 people for quarantine after they return to the United States from China. As of Friday, more than 31,400 people had been infected with the coronavirus. Today, the coronavirus is that number, just from Friday, it was 31,000. Today, that number is over 40,000 that have been infected. Now, the reason why I bring this up is because there's something that we should pay attention to now. Does the federal government have the quarantine rights? The quarantine powers outlined under federal and state laws do order the CDC and Health Department and Human Services to declare a medical quarantine, including commandeering local and state facilities and law enforcement agencies and officers. The list of agencies include the Coast Guard, the Border Patrol, Customs at ports of entry. But it does not include any provision for the use of military, U.S. military, either domestically or internationally. After SARS, that scare in 2003, Bush II issued an executive order that authorized the use of the National Guard troops at the discretion of state governors, specifically for SARS quarantine, if it would become necessary. That order has been updated now 3 times, most recently in 2014 by Obama, to include longer lists of diseases, including Ebola. But the Posse Comitatus Act, passed in 1878, prohibits the use of U.S. federal military, Army, Air Force, Navy personnel from being used to enforce domestic policies or laws within the United States. It is noteworthy, perhaps, to note that the act does not include the U.S. Marines, at least by name. It does not specifically also include Coast Guard, National Guard, military, police from being used, and certainly bases.
Does it include Space Force?
It does not include Space Force.
I
Yeah.
mean, this is a big story.
Yeah, big story.
We need to break this.
So we have 250 people who are quarantined on a military base. Does anybody care the fact that the military doesn't have the right to do that? Now, they're offering it up for the Department of Health and Human Services, but when do we care and when do we not care? I mean, if this thing is spreading like wildfire, how many people are going to actually go, the military can't do that? Who's going to listen to them? This is how fast we change, is in a dire emergency. And I don't think we're going to be in a dire emergency. I think we're just really prepared for something. Because all of the medical stats coming out of China show that, yeah, it could be a big deal there, but and maybe in Europe because of the amount of smokers, but it shouldn't be here in the United States.